Hello, everyone. I'm Amina Mahmood from the SingHealth Duke-NUS Global Health Institute. And on behalf of the Institute and the co-organizers, the American Chamber of Commerce in Singapore and the Swee Hock School of Public Health, I'm delighted to welcome all of you. Thank you for sharing your time with us. This is the fourth and final webinar in our webinar series on the science and business of COVID-19. This webinar peers into the future and will try to sketch what the new normal might look like. To take us through this journey, we have a panel of esteemed experts spanning 3 continents. And as such, we have them over 3 time zones. So thank you very much, panelists, for sharing your time with us and taking this time out for some of you from the US very early in the morning. They will be ably guided through this exploration by our moderator, Christy Lou-Stout. Based in Hong Kong, Christy is an award-winning anchor and correspondent for CNN. I'm sure none of you need much of an introduction to her, and I've kind of seen her on your TV screens most of the time. She has a great familiarity with the region. In 2018, she was awarded Best News or Current Affairs Presenter at the Asian Academy Creative Awards, and the daily news program she hosted, Newsstreams, also got the Best News Program. In addition to her shows, Christy likes to engage with her viewers on social media and kind of propel her stories which are close to her heart. I see that she often takes up women's issues and women's stories which really resonate with me. But of course, in today's day and age, she's looking at a lot of COVID-19 stories, including something from looking at how Hong Kong and Singapore have handled a pandemic, to even following the evolving advisories on whether we should be wearing masks in the public or not. But anyway, I won't take up more time, and I'll just say on behalf of all the organizers, thank you, Christy, for moderating this panel, and over to you.
Amina, thank you so much for that kind introduction, and to everyone participating and watching, welcome to this webinar. Again, it's called A Post-COVID-19 World, What Will Be Our New Normal? And I just want to kick things off by quoting the Indian novelist Arundhati Roy, who wrote, "The pandemic is a portal. Pandemics have forced humans to break with the past and imagine the world anew." So what will our new world look like? And how are we going to get there? That's what we're going to discuss in the next hour. We're going to discuss in depth the current crisis, how it will evolve, and how it will eventually resolve. And joining us to do just that is an esteemed panel of experts. Let's meet our speakers right now. We have Professor David Heyman. He is a professor at the London School of Hygiene and Tropical Medicine. We are also joined by Ms. Reshmi Khurana, Managing Director and Head of Kroll in Southeast Asia, Professor Gabriel Leung, Dean of Medicine at the University of Hong Kong, and Professor Michael Merson, Director of SingHealth Duke-NUS Global Health Institute. So thank you for joining us this evening or this morning, wherever you're tuning in all over the world. And let's begin with this. Given the global reach of this webinar and the global expertise that's represented in this panel, let's talk about first the theme of global collaboration. We're going to go in alphabetical order. So Professor Heyman, we'll start with you. David, how important is it right now at this moment during the coronavirus crisis to have a unified global response?
Well, it certainly would be ideal if there could be a uniform response when every country begins to change into a new mode of operations after this outbreak. So it would be great. And that would include ensuring that air travel can begin in a controlled manner, and many other things that have been shut down can begin, so that no country is at greater risk than another, and that all are working together toward the common objective, which doesn't seem to be the goal at present.
And Reshmi, wanted to ask you a question that was submitted by someone in advance. And the question is this: how can the Asia-Pacific region collaborate better? Sorry, Reshmi, we can't hear you if you are on mute. Yeah. Okay, unfortunately, that's not going to work out. I'm just going to pose that question instead to Gabriel Leung. Gabriel, I haven't had a chance to check in with you yet. Could you take that question? How can the Asia-Pacific region collaborate better?
Sorry, you want me to answer that question instead of Rashmi?
Yes, please.
Well, first of all, I have a standard line for that sort of question. My standard line is this: we're in a marathon. We've barely run the first 200 meters. I don't know of any marathon runner that looks back and then not think about the next 20 some odd miles, as opposed to the very short sprint we've just had. So I think it's, you know, tongue-in-cheek comment or response aside, I think it's wholly unhelpful and inappropriate to try and do any kind of retrospective or to come to any judgment about relative success or failure at this point in time. I think in the spirit of full transparency and accountability, there will no doubt be a very serious and a whole range of commissions, inquiries, audits, reviews at the end when all is said and done and when this has actually settled down, which may be a year away, maybe 2 years away.
Okay, so
but to try and do it now, I'm not sure it's at all helpful.
Understood. Let me rephrase the question then and pose it to Michael then. And Michael, you know, as a scientist, as an expert in infectious disease, what would you like to see world leaders do right now as they respond to the crisis?
We learned from the AIDS pandemic that global cooperation is very important when you face a pandemic of this nature, of this size, and here at this speed. And I would say there are at least 3 areas where I believe it's not too late and we really need global collaboration. One is we need a platform just, you know, really to share knowledge and experience and provide guidance on best practices. And obviously the best place for this is the World Health Organization, and WHO has performed this for the most part well. There's now some criticism of the organization in my country by our government. I don't want to go into it here. I would just say that whatever weaknesses WHO might have, this is certainly not the time to be discussing them. We need to have a strong WHO to provide that platform.
Yeah.
Secondly, we need a global platform for research. We've got over 100 vaccines under development. We've got over 300 drugs trials underway. These need to be well coordinated, and I'd simply say that there are steps being taken in that direction. That's a good thing if we're going to make the most of our science. And then thirdly, in my own view, we need some mechanism to bring countries together, the richer nations, to support the public health efforts of low and middle income countries. They're going to face the real brunt, many of them, of this pandemic, and as we move on in time. We've seen the Global Fund has allowing its funds to be reprogrammed. We've seen Gavi and the World Bank take steps to make funds available, and that's all fine. But I think a multilateral forum, maybe one that brings us back closer again to true multilateralism, can be very helpful. In the case of AIDS, you know, we created a new UN agency called UNAIDS. We don't have time for that.
Yeah.
We need to figure this out and figure this out fairly quickly. Lastly, I'd say that earlier this month, the UN created something called, I'm reading here, the Global Humanitarian Response Plan for COVID-19 under the UN Office for Coordination of Human Affairs, and the Secretary General called for $2 billion. I mean, that's all well and good, but I don't think that's going to be sufficient to consider this simply a humanitarian problem. It's a much broader problem, and we need to keep thinking about what might work best.
Yeah, I believe we have Rashmi back online. And Rashmi, I just want to get your thoughts on the issue about the importance of global collaboration. And back to that question that was submitted earlier by a participant of this webinar, how can the Asia-Pacific region collaborate better?
Thanks, Christy. I think these technological problems tell us a little bit about what the post-COVID world looks like. So sorry about that. Well, I think, you know, from a business perspective, we think it's already a little bit late in terms of global collaboration.
Yeah.
I think a number of developing countries, when you talk about Asia, look up to multilateral organizations, often where the agenda and the guidelines are set by the developing world. Now, whether it was because the pandemic started in Asia or other reasons of sort of non-collaboration fully, that didn't happen early on. And even now, we're seeing that typical method of, Asian countries looking up to more developed countries in terms of how to handle, what processes to bring in, what methods to adopt, both for prevention and for cure, haven't really played out the way they should. I think in terms of going forward, now it will have to be, the collaboration will have to focus a lot more on treatment. I think the vaccine effort obviously is, the experts here know, much more diverse. We'll have to be on treatment, some degree of opening borders, starting trade and movement of goods and people. I think that's where I would put the focus of collaboration going forward.
Gotcha. Now let's talk about the race to vaccine development, because that's something that a lot of people are talking about. A lot of people have questions about is, when there's a vaccine. David, there's a lot of progress on vaccine development there in the UK at Oxford University. When will a vaccine be available?
Well, there are lots of issues around a vaccine. And the first is that we really don't understand whether an infection with this coronavirus produces lasting immunity. We don't understand the immune response to this organism. And we know that with other coronaviruses, immunity doesn't last a long time. It lasts maybe one season, and then the next season, among those 4 coronaviruses that are inhabitants in humans, there can be a reinfection with the same virus. So we know that there isn't great understanding about immunity. We'll get a lot of that through the vaccine trials going on. And those vaccine trials are going on, and there are many. There are over 70 different vaccine trials in various phases of vaccines in various phases of development using technologies, using whole RNA, virus type, whole RNA vaccines, virus-like particle vaccines, which are synthesized in a laboratory, and the classical vaccine development. We don't know whether any of these will lead to an effective vaccine. We hope so, but then the problem is development of that vaccine in a way that it can be mass produced, and finding a producer that can do that without taking off other vaccines such as measles vaccine or seasonal influenza vaccine from the assembly line or from the fill and finish line. So there are lots of questions to be asked, and it's not yet a given that there will be a vaccine, but if there is that vaccine, then it's a matter of finding where it can be produced in the quantities necessary for equitable distribution throughout the world.
Got it. You have to be able to produce it, and also to produce it for the target audience, which is billions of people, and to distribute it in an equitable way. But I want to get more on the pace of vaccine development, especially what's happening here in Asia, and namely in China. And Gabriel, there's immense pressure for a vaccine to be available ASAP. We know that there's work underway in Hong Kong and in China. What can you tell us about the latest on that effort?
I think that vaccines are not going to be widely available to sufficient numbers of people worldwide so that the whole pandemic would settle down into likely a seasonal endemic virus. So I think that we're going to be very disappointed if we are looking for a quick fix from vaccines. That said, I note some very recent, in the last 24 hours, comments, very positive, encouraging, optimistic estimates of maybe a 6-month delay instead of a year and a half or 2-year delay from Adrian Hill from the Jenner Institute of Oxford. I'm not entirely certain whether he may be referring to a potentially safe and effective vaccine becoming approved, or maybe it doesn't refer to wide production and distribution yet. And there are more than 100 candidate vaccines that are being worked on at the moment worldwide, whether it's in North America, in Europe, or in China. But I think what we really need to do is to make very sure that this is safe, first and foremost. Yep. We do not want to repeat the painful challenges of the measles vaccines, the RSV vaccines, and the dengue vaccines. There are clear, or for that matter, the 1977 flu vaccine. Now, that said, I think that we also should be very clear that we don't really need a perfect vaccine. Because if on a large scale, if you have something that is even imperfect or what we call leaky in terms of vaccine technology, even if it just reduces the severity of illness amongst people who have been vaccinated if they catch the disease, so that you can reduce the, say, symptomatic case fatality risk of now about 2% down to 1% or 0.5%, that would already be a huge improvement. That would be equivalent to having a magic pill as a therapeutic option, not as a prevention option. Secondly, if that vaccine can perhaps reduce also your infectiousness, so that even if you do get infected, you don't shed quite as much or quite as easily, or perhaps quite as early as you do now, which is up to a couple of days before you even show first symptoms, then that again would have been able to reduce that transmissibility by a huge margin. And both or either of them would be major improvements already.
Wow. I wanted to get Mike's thoughts on that. So Mike, we heard from Gabriel saying, 100 candidate vaccines are being developed right now. Pressure again is immense to bring them to market quickly. Gabriel says that he would accept an imperfect vaccine. What are your thoughts?
Certainly want a vaccine that brings sufficient immunity, at least for a year, if we're going to think of it as a flu vaccine, that would prevent death and hospitalization. That would be at least what we would want. And certainly we would want to think about how to use that vaccine so it has the most benefit. Obviously, you probably first want to use it in first-line healthcare workers, but then probably in the senior citizens and those that are medically vulnerable, and then to the entire population. That would still be a good vaccine to have. I think in the shorter term, one has to be optimistic that we'll have treatment that maybe won't prevent or cure the disease, but again, will prevent death, like we have with influenza today. I think if we can avoid the death that this disease occurs through treatment and through a vaccine, that would be a great contribution. Now, of course, we'd like a vaccine that prevents disease, and that should be our ideal goal. I think one of the critical issues here, I think it's great that the Oxford University team is out in front. They had experience working with a coronavirus before. I understand they're going to be injecting as many as 6,000 people by the end of May, and that's all wonderful. But my previous panelists have pointed out all the challenges that a vaccine is going to have to produce, an insufficient quantity, and then to deliver. I think that's a critical step. Getting, whatever populations we want to deliver, we need to be preparing now for that delivery. And also we need to be sure that we are thinking now about where these vaccine trials are going to be so that we can get the most information about the efficacy of these vaccines.
Absolutely. There are immense challenges to make and deliver a sufficient amount of vaccine. And a question for Reshmi, this is a question that was submitted in advance. How can poorer nations be able to get affordable vaccine?
Sure. I think many developing nations have a track record of manufacturing and scaling up on drug development. So I think that shouldn't be a challenge. It's more, getting your hands on. I also saw the questions about, will there be cooperation in that respect, right? So I think, China is also developing a vaccine. So, having access to that amongst developing nations. I think different companies and different governments will, it's hard to predict how they will proceed, but I think there will be an element of sharing and a humanitarian element to it. And I think a number of companies in Asia are preparing to rapidly increase the production when something promising comes online. So I think the greater challenge today is getting the science right. And then I think market economics, and again, hopefully the element of cooperation that we talked about will ensure that developing countries, in some order will have access to this vaccine. For example, India certainly, right, with its track record, manufacturing generic drugs in large quantities at good quality.
And let's focus more about COVID-19 in the developing world. David, the first question for this topic is for you. There is huge concern about a potential third wave of infection in developing countries. When we've seen the way the coronavirus has had such a brutal impact in the first world, what's going to happen in poorer countries?
Well, what has to be at the basis of all responses, and especially so in developing countries, is having populations understand, even communities understand, how people can protect themselves and prevent infection of others. And there are very standard ways of doing that. We all know hand washing and making sure that we maintain a physical distance and not attending social events that might transmit infection, including funerals and a whole series of things. So there are many things that countries can be doing to put a good basis on what happens in the future. At the same time, I know WHO is working very closely with countries in the developing world to understand actually what's going on. Yesterday, I was at a WHO meeting by Zoom, and at that meeting, we had presentations from South Africa, from Senegal, and from Nigeria about what's going on in those countries with COVID. And it's not the same as is going on in European countries, at least yet. There aren't so many elderly people in these countries. There's a great number of young people in these countries, and they don't seem to be having infection. In fact, in South Africa, they've been able very well to strengthen their health systems, and they feel that they will be able to help people understand how to protect and prevent, and that will be one of the major ways that they'll move forward. So I think there are many tools we have that don't require vaccines or drugs to really prevent this outbreak and to put a foundation on moving forward. And that's what the world will have to look like in the future, is a world where everybody understands how they can protect themselves and prevent others from getting infected, should they be sick or should they be carrying the virus.
Yeah, so what are those tools to help developing countries? Gabriel, how do we help them?
I think that it is a very good question, because I have said from January that we are on course to witness and experience the gravest health inequity of our time, almost by omission. And the omission is by the richer half of the world. Unless the rich countries and political leaders join hands together in that grander sense of solidarity and proactively reach out to the low and middle income countries and address the COVID challenge, this will happen. Even amongst and within the richest countries, we have seen already direct and very steep socioeconomic gradients in terms of the number of infections and the fatality risk. We see it in Chicago amongst African Americans. We see it amongst the BAME population in the UK. And we see it in Singapore. If you look at the attack rate of COVID-19 in the permanent residents and citizens general community, and compare that to the migrant workers who live in dormitories, it is fully 150 times. So I think that it is a very serious concern, and the last thing we want to do is to see the number of deaths track closely with GDP or the availability of ICU beds. Over.
Gabriel, you make a really important point. Even inside first world countries, from the United States to Singapore, the have-nots are getting hammered by the virus. The next question going to Mike. Mike, when this is taking place, when the have-nots within the society of a first world nation are being neglected and being so vulnerable during COVID-19, do you think wealthier nations like the US or European countries have enough thought and concern to think about what's needed in the developing world to avoid a third wave of infection and devastation?
Well, I am concerned right now that the richer nations are very focused on their own situation and not giving anywhere near enough attention to the kind of problems that we might see in low and middle income countries. I'm reassured by what David has said so far about the relatively low rates. That's good news. In many of these countries, I'm thinking in particular in the African region, but it's not easy to even find soap and water, and living conditions are very tight. So social distancing is tough, just like here in New York City, which is an extremely dense city and accounts for a lot of the high rate we see here and the disparities in infection. The one projection I saw from Oxford University, the best scenario is that there would be 1.3 million COVID deaths over the next 250 days. But I want to just add one other important point, and that is that it's not just the impact of COVID. Yeah. But I'm also concerned that the pandemic is, particularly everywhere, but particularly in low and middle income countries, the impact this pandemic is going to have on other health programs. We're already seeing that measles vaccination is not being given. Polio eradication programs are being slowed down. AIDS drugs are no longer as easily available. And I can go on. The point being that the impact of this pandemic is not only could be more deaths and subsequent poverty from COVID, but also other diseases that are now going to receive less attention. This is a real concern for me. And then lastly, I would say that one of the things that struck me was that in a number of the lower income and middle income countries, their strategy for COVID was directly to go to mitigation. They didn't even try a containment strategy, maybe looking at the China and US experience. But eventually, as these countries let up their severe mitigation strategies and then try to work through a containment strategy, which they're going to have to do to protect their, to improve their economies, like the same dilemma we're facing here in the US, what are the challenges they're going to face then in dealing with COVID? So it's a complex situation, but as your question implied, is not yet getting the attention it needs from the richer nations. And I'm hopeful that the Global Fund and WHO and other international organizations will eventually and soon take this challenge on.
Got it. Thank you for mentioning that the horrific knock-on effect of COVID-19, the public health impact affecting malaria and AIDS outreach as well. So Reshmi, to help poor countries as well as poor communities, what is needed to fill the gap here? To help out international organizations like WHO, do we have to rely on organizations like the Gates Foundation, et cetera? What is needed? Who needs to step in to fill the gap?
I think those organizations will have a role to play, but going forward, I see the response being very driven by, not just by different countries. I mean, even the developing world is a very large world. Within that, there are countries, and within countries, there are states, just like America is seeing the disagreement between different states in terms of how to weigh, life versus economics. Those same debates are taking place all over. So I think the response, including the economic response to fill the gap, will be much more micro than international or even country level. I think it will be driven by individual decision makers and constituencies. It will be driven in some cases by individual communities. And I think overall in the medium term, what we'll see is this rise of sort of economic nationalism, which already was playing out even before this crisis hit, right? From the trade war and before that. I think that trend will continue. So to answer your question on what will fill the gap? It will be the efficiency of monetary and fiscal policies in delivering benefits directly to the poor, so we can address things like malnutrition and deaths and the effect of the migrant crisis that's taking place. So these will have to be broken down by sector, by problem and geography, and we'll have to be very nimble, the countries, in responding to each of these problems. I don't think there never is a one-size-fits-all, and this pandemic is an example of that.
Got it. And now that we've hit 30 minutes past the hour, it's time to touch on the topic, which is the headline of this webinar, imagining a post-COVID-19 world and life after the pandemic. David, what are the benchmarks to get there? What are the benchmarks for a return to normal?
Well, first of all, we have to realize that we don't yet understand the destiny of this virus. As Gabriel said earlier, this virus might come back, it might not. We just don't know what will happen in warmer weather in the north and various other aspects of this virus. What we believe is that it might come back in seasonal, like influenza, but we don't know for sure yet what the destiny is. But what we do need to do is learn some of the lessons from this outbreak. And one of those lessons that would be very useful to learn is how green the world has become and how rapidly it has recovered in many spheres when traffic has decreased, when airlines are no longer flying around the world, and all these other benefits that have happened because of the lockdowns that have occurred. We've actually seen an experiment in process as to how rapidly we can see blue skies again and how rapidly we can decrease asthma and other diseases related to the environment. So hopefully in the future world, those lessons will have been learned and we will more rapidly approach a world that is greener and that does have less threat to humanity moving forward.
Absolutely.
At the same time, we'll see changes in behavior. We'll see caution in social events, in rock concerts and various things where people gather. And we'll see people wanting to physically distance and to social distance, but we'll see how long that can really last. But I think there will be some glimpses through the next months of what we could change, such as meetings such as this, which will make the world a much greener place and a much better place to live in the future, with or without the coronavirus.
No, absolutely. We're enjoying a beautiful blue sky day here in Hong Kong, and we've seen the reports of people being able to see the Himalayas for the first time because of the pandemic, the positive knock-on effect of the pandemic. Gabriel, I wanted to pose this question to you that was a question submitted in advance, and it's this. What makes us think that there will even be a post-COVID-19 world? Should we be all thinking about how to live with COVID?
There will be a post-COVID-19 world, just as there was a post-SARS world, just as there is a post-Ebola world, just as we came through the last pandemic, which was barely 10 years ago in 2009. So there is going to be life after COVID-19, but it's going to be a new normal. I don't think that this is like SARS. SARS didn't even infect 10,000 people.
Yeah.
And here we get 10,000 new cases that are reported, not even infected, but reported in single countries or single cities per day. So I think that that's one, the disease is very different. But secondly, I think the world as we knew it going into COVID-19 compared to the world back in 2002 and 2003 going into SARS are two vastly different worlds, from geopolitics to national politics to the underlying fundamental social tensions. And I think that that's really going to drive what the post-COVID-19 world is going to look like.
It's encouraging to hear that there will be a life after COVID-19, that there is such a thing as a post-COVID-19 world. But Mike, when will we know when it's time to reopen a nation, to end a lockdown, to end circuit breakers for those watching from Singapore, and to start flying again and return to normal?
We are certainly struggling with this question right now in the United States. And unfortunately here it's become in the middle of a presidential election. So it's been crowded in political issues with demonstrations on the streets, which are not very helpful. I think in the short term, we've got to balance the safety and health of our population. I live here in New York. We were 1 week away from our health system being completely overwhelmed and having to make decisions about life and death. And we can't let that happen again. This is, of course, what Northern Italy faced. And obviously, we need to balance that, the capability of our healthcare system, with our economy and the fact that many people cannot, they live paycheck to paycheck and need to be able to earn a monthly income. That is the most immediate challenge, is how to find that right balance. And what are the parameters that an area or a region can use in terms of cases, for example, new cases to allow a region or an area to open up. A lot of this depends on having available testing, and I'm sure the audience knows this has been a major issue in the United States, where we, for complex reasons, still don't have anywhere near the amount of tests that we need. So I think there is this short-term tension about the best way to open society, balancing their potential health needs, the need for services that are for the population. And this is going to continue over the next few months at least, maybe next year, until we have a vaccine, as we struggle with second and maybe third waves. Here in North America, we've seen the second and third waves in Asia. Now they've occurred for different reasons, perhaps, but nevertheless, they have alerted us all to what happens if you let your guard down.
Yeah.
So I think that's the most immediate issues that are going to come up with regard to finding the right benchmarks. Yeah. There are, of course, larger, longer issues, which I suspect you're going to come back to.
Thank you, Mike. Rashmi, your thoughts on this? Can we get back to the life we had before COVID-19, and if so, how?
So I think if the definition of going back is, consumer confidence coming back, because that's when, we will get on flights with our families and buy that new car that we planned. And similarly, confidence of businesses coming back, right? So they will put up that additional plant that will produce the additional goods, and then global multinationals will buy. So I think fundamentally the benchmark is consumer and investor confidence coming back. And for me, those markers that will depend how quickly that comes back goes back to the two things we discussed earlier, which is markers that indicate that this disease can be prevented, and the fact that it can be treated or it can be treated. Of course, there's a third marker, which is the virus mutates and just magically disappears. I've heard, biblical conspiracy theories and others that it will go just as quickly as it came. And the markers for prevention are, of course, vaccines, and the panel here, is much better positioned than I am, but also ability to test. I think we heard about mass testing, when you can go to your GP's office and get tested, or when you can buy a test kit, just like you can buy a home pregnancy test kit, right? Where testing becomes a trusted way of knowing the degree of risk you have. And to some extent, compliance to these social distancing measures. I talk to friends in the UK and I talk to friends in Singapore, and both the measures and the compliance levels are vastly different. And that affects, again, consumer and investor confidence. And then going down the curve on treatment, again, are we going to wait for the vaccine, or are there indicators? I've heard of, oxygen treatment being helpful. Can that be scaled up? Will that give confidence to doctors and consumers and sick people? A resurgence of the virus. So I think all of these, again, we have to break down the markers into prevention and treatment, in my view.
Now let's talk about the legacy of COVID-19 and preparedness. And David, the question that I'm going to pose to you is one from a webinar participant who is asking, what new measures will the world put in place to ensure that we are prepared for the next pandemic?
Well, unfortunately, that depends on the memory span of our politicians. And you know, in the past, that memory span has not been shown to be great. We've seen that countries in Asia have been prepared for this outbreak because they had the SARS outbreak, they had the MERS coronavirus outbreak, and they learned lessons from those. And they built the surge capacity they needed. They took those to heart. We've seen in Europe and in North America that there have been exercises that have shown what could happen should an outbreak like this occur. And we've seen in action in certain of those countries to develop the surge capacity that's necessary to deal with one of these outbreaks. And that's been the Achilles heel in Europe and in North America in facing this outbreak. Hospital deaths, when they began to occur so greatly in Italy, spurred the rest of the developed world to begin to try to flatten the curve so they didn't see the same thing. If they had learned from the lessons in the past, built the surge capacity, or at least had an idea how they could rapidly do that, they might have prevented having to lock down and might have been able to take care of the patients in a much better way, as has occurred throughout Asia. I'll let Asian participants speak about that response. But, you know, politicians don't learn long-term lessons. Politicians are voted in for a period of 5 or 10 years, and that's the span of their interest, unfortunately. But the business community might also learn from this and might continue to spur the governments to take this seriously, which hasn't really occurred in the past. Business has also looked at the bottom line rather than how to be prepared for the next outbreak when it occurs.
Well, let's assume in an ideal world where politicians can learn long-time lessons and the population, you know, votes in politicians who respect science. Let's assume this. What are the key lessons learned from COVID-19 to lessen the risk of the next time? This question for Gabriel. What are the lessons from COVID-19?
Again, I'm not trying to cop out of your question, but I think it's way too early to really speak of learning lessons or drawing lessons yet. I think the heterogeneity, that is the diversity of experience of some places which has never really had a first wave of local sustained outbreak like Hong Kong and Taiwan, to other places which has had catastrophic first wave outbreaks like in Wuhan, in Bergamo, in London, and in New York City. I think that, you know, it's very difficult to try and draw lessons that are common to all. What I would say is that there are sufficient lessons in terms of what may work and what definitely does not work in terms of public health interventions, that those who are perhaps later in experiencing the first wave could then benefit from those earlier experiences and earlier practical lessons. But just remember, for those who have already had very large outbreaks, the toll on lives and livelihood has been enormous. But for those like in Hong Kong, where we haven't had a first wave of sustained local outbreak yet, the job and challenge is even more profound, because the more successful you have been, the longer you would have to be ultra vigilant in making sure that you do not then fall into that first local sustained outbreak. And we always try to make sure that we balance health protection with some sense of normality or minimizing the economic and social disruptions that really a large first wave could and would bring. Over.
Yeah. There is no shortcut to a pandemic. Vigilance is key. Mike, here's another question from a webinar participant asking, how do we make sure that the international community comes together to prevent a recurrence of this happening again?
Well, getting back to David's excellent point, it really is going to be up to national leaders. And to the business community more than anything to make that happen. We have seen it happen, as I mentioned earlier, in AIDS, when there were so many deaths and fear of the future. I think that it often takes some advocacy as well from groups that are at most at risk for this to happen. The thing I've been thinking about is that two things. One, that one would hope that in our own country, in the United States, 55,000 deaths in a 2-month period, you would hope could not be forgotten by any politician.
Yeah.
And that at least we might have a national plan, a national stockpile that has something in it, and be able to avoid this in the future. The second point I would make, to look a little bit at a larger picture here, and in terms of getting more of a global response, this coronavirus, I believe, is the 6th bat-borne virus to cause an epidemic or pandemic in the past 25 years. The others being SARS and MERS and Ebola. These viruses are presumed to infect an animal host that then passes it on to humans, starting with the bat to the animal to the humans. And why? This is really because we have in our lifestyles disrupted our ecosystems, and we have shaken these viruses loose from their natural host and given them the opportunity to move on to new hosts. The viruses seize this new ecological situation, the new environment, they adapt and become our diseases and our epidemics and pandemics. And I think what this is telling us is that we need, despite its complexity, we need to think about in getting the kind of advocacy you're talking about, a much more comprehensive One Health approach, where it's not simply physicians or epidemiologists or public health leaders, but we also need those that work in the veterinarian sector, the food sector, the economic sector, to realize the impact of what this pandemic can have on our lives and approach it in a comprehensive way. In a way, it's a good thing that we don't need to tell the world's population what global health is anymore. I think people now know that the world is interlinked with regard to health, and we need to build on that this phenomenon to raise the world's attention to what we can do better in the future.
Mike, you speak of a One Health approach, of an approach in a unified, comprehensive way. Reshmi, how optimistic are you that there can be a change in mindset among political leaders and business leaders about viruses, about global health because of this crisis?
I think there's a short-term reaction and there's going to be a long-term realization. I think in the medium term, we will see businesses and governments going into a mode of self-reliance and thinking that this can happen again, and how do we make sure our economies and our health systems can be self-reliant. And I think to some extent in the medium term or short term, I expect local governments across the countries to have a greater role. We always talked about the capitalist idea of less government is good, but I think we're going to see more government, both in economics and health, a bit like how defense was, to become more self-sufficient. I think going forward, in the long term, what this virus has taught us and this pandemic has taught us is sharing of information. And I think there will be more strategic sharing of information, and everybody recognizes if that had happened earlier on, steps could have been taken. And I think, again, companies will have to find new economic and business models to appeal to that. So we've already seen companies offering their IP with the ventilator technology, for example. But a lot of the issues that have had seem ad hoc. And again, there will need to emerge some sort of leadership whether it's governments or whether it's multilateral organizations, to bring that all together to prevent such a pandemic from happening again. Because I think, unfortunately, a ad hoc looking back how it happened the last time may not prevent this from happening in the future.
Got it. Rashmi, thank you. We are now in the home stretch, only 10 minutes left in our conversation, and I would like to end things on a more personal note, a personal question about the impact of COVID-19 on your lives. We know everyone's lives and livelihoods have been disrupted, upended by the pandemic. On a personal level, how have you been affected? And David, we'll start with you.
Well, I've been affected because I'm in one of the risk groups. I'm over 70. And so that is a real concern to me. It's more of a concern to my family. And we're locked down now in France, outside of Switzerland, where I have 2 children and spouses who are working as doctors in Switzerland. And so they're afraid to come back to the house to see me across the border because they're afraid they'll bring me a disease. And so it's really disrupted in many ways our family life. And I'm sure that's true for every other person, that they've been disrupted in some way within their own family, being able to deal with this outbreak. I live in London. I came to Switzerland, to France, actually, outside Geneva, to be with the family, to support them. And now they're afraid really to come back and forth across the border because they may be carrying me an infection. So that's a concern that I have. But my greater concern is for the world in general. And that concern is the geopolitical tensions. And I think we have some indication that those geopolitical tensions can't disrupt technical collaboration through organizations like the WHO. I've been at a series of meetings chairing a group at WHO, and the Chinese CDC, the Iranian government, all governments are sharing their information, including the United States government, in a way that permitted us to rapidly learn what's going on in this outbreak and understand this virus. So I think from my own personal view, it has just renewed my confidence in the fact that technical people are willing to work together for a common goal, and that is to preserve life and to deal with issues when they come up on a technical level, letting the politicians do what they want to do at the political level.
David, thank you. Gabriel, on a personal level, again, how have you been affected or transformed by the virus?
Well, let me give you the serious answer, and then I'll give you a lighter answer to end. My serious answer is this. I happen to be in 2 rows that are very much affected by COVID-19. By trade, I'm an infectious disease epidemiologist. So clearly, I've been a little busy along with the rest of my research team. This is not an easy experience, especially because it is a very prolonged pandemic. And my other row, my other hat is the Dean of Medicine. So I have about 8,000 people in the faculty, and many of these people have already been disrupted in their studies and in their personal lives, not only by COVID-19, but also for 6 months before COVID-19 by the social unrest in Hong Kong already. Yeah. So you can imagine that this is really quite an extraordinary time in our history. And we've been around for 130 some odd years already. So that's the honest answer, the serious answer. But the lighter answer is, I remember SARS helped me shed 35 pounds.
Oh my goodness.
And I'm very quickly putting on almost all of it back, simply because of the way we need to physically distance and therefore physically almost waste away muscles as we all get locked down at home during this very prolonged pandemic. Over.
Gabriel, I'm so sorry to hear about that. I can recommend some Sworkit apps, workout apps for you, if that could help, but we can continue that discussion another time. But let's hear from Mike, because I know he has to leave promptly at 7. And Mike, your personal takeaway, the impact of COVID-19 and all of this on you.
All right, so 3 quick reactions. One, like David, I'm in a high-risk group. And so I also have had my family life disrupted, particularly with grandchildren that just live a few blocks away. And you know, Zoom and FaceTime have been technologies that I have learned finally how to use, and that's been helpful. I've also teach, and I've learned how to teach online, which I had never done before. So a little silver lining there. Secondly, I've come to appreciate even more so the health disparity issue that Gabriel mentioned earlier. It is really, when you live in a place like New York City, although there are many cities in the States that we've seen this, you know it exists, but when it's right in front of you, so visible on your television or in your computer every day, over and over, you have to get angry that we've allowed ourselves to allow such disparities to exist. And now, of course, we've got to think more about how to address them.
Yeah.
And then thirdly, I can't tell you how much I've been impressed by the bravery of healthcare workers. Where I live, I live near a hospital, and not so much right now, but up until last week, there all day and all night, all you hear are ambulance sirens. That's all you hear on the street. It's a very eerie feeling. But then when you hear the stories of what healthcare workers have done, it's just remarkable. I was very much involved in the AIDS pandemic back in the 80s and 90s, and there were brave healthcare workers then, but not like what I've seen now.
Yeah.
And it's just been remarkable. And you know, we bang our pots and pans at 7 at night for these workers, and we really all need to remember what they've done for us.
Absolutely, Mike. Thank you for that salute to frontline healthcare workers in the United States and all around the world. And finally, Reshmi, we need to hear from you, your personal takeaway about the impact of the pandemic.
The impact has been significant. It has upended all the assumptions we had about our international lives. I have parents who live in another country who are older. My husband does back and forth, 10 days in one city, 10 days in another. All of those lifestyle choices are now being put, sharply into focus in terms of, is this possible to continue and is it worth it? So I think that's number one. But I live in a city that has managed to control the situation remarkably well. And India hasn't suffered as much as, again, many of the other stories we hear. So it's also an opportunity to be thankful and try and look for the silver lining. But on a more somber note, I do think this pandemic will lead to a larger humanitarian crisis, which we know is already at our doorstep and will unravel in many different ways for different countries. So I think and that brings political change and so on and so forth. So I think we still have to be very careful about what the future holds for us. Thank you, Christy.
Reshmi, we thank you for that sobering and important final point. The pandemic will fundamentally transform how we all live. I'd like to thank all of our speakers for your availability, for your expertise, for the important work that you do, and for, during this webinar, laying the path ahead to imagining how do we get to a post-COVID-19 world, and may we all get there with collaboration, with compassion, and with science-based policymaking. Thank you, our panelists, and to everyone watching, and to the organizers of this webinar. We're going to wrap it up now. Do stay smart and stay safe. Take care, everyone.
Just want to say thank you to all the panelists, and we are all in this together.
Absolutely. Take care. Thank you.
Thank you.